One of the main functions of a clinical psychologist is to do psychotherapy. And people often ask me, what does that mean? What is psychotherapy? They know what they see on movies, where typically they'll show some guy or gal lying on a couch, usually with a tissue to their head, and crying about what happened to them when they were 3 years old. And that has become the kind of caricature model for psychotherapy. But in fact, there are many different types of psychotherapies geared towards many different types of applications. And you can divide them basically up into three categories. The most traditional model is what we can call transformative psychotherapy. That is, an individual has a lifelong dysfunctional pattern of behavior. They have trouble keeping jobs. They can't stay in a relationship. They have difficulty dealing with authority figures. They have difficulty dealing with health issues. And no matter what they try, it doesn't seem to work. And they may suspect that there is something stemming from events in their life that is inhibiting them from getting the most out of life. And in these cases, what you will do is an exploratory type of process, trying to figure out how some of these behaviors develop, how they interact with that person's biological and genetic proclivities, and through a gradual process of psychotherapy, reconstitute certain aspects of that person's thinking, feeling, and one might say even basic personality, so that what emerges is a different kind of person that thinks a little differently, that feels a little differently, that reacts a little bit more adaptively, and is able to deal with the world in a much better way. So you're really not targeting a specific problem, because what you're targeting is the underlying dynamic that fuels many of the problems this person has had. And in many cases, with skill on the part of the therapist and commitment on the part of the patient, patients can make great progress, and lives can be changed in the process. Just as commonly, in fact, probably more commonly, is the second main type of psychotherapy, and that's what we can call corrective psychotherapy. And here, the person really does come in with a specific problem. They have difficulty completing projects. They procrastinate, and they don't know why. Or they have a tremendous fear of public speaking or making a presentation at work. But the problem is limited to a particular type of unit. And in this case, you can use a much more focused and targeted type of application, usually something in terms of what we call cognitive behavioral therapy. That is essentially a combination of therapy and coaching, where you help the person develop more adaptive habits applied to that particular situation. Now, sometimes what will happen is a person will come in for a specific application, and as the therapy develops, it turns out that this is really more of a broader pattern, and it may sort of devolve into this type of transformative psychotherapy. Or a person may come in and claim that they have a dysfunctional personality and want to go into several months or years of analysis to find out what that is, but after a couple of sessions you realize they're not that dysfunctional at all. If they can sort of solve this particular issue, if they can learn to be a little bit more assertive at work, if they can learn to be a little bit more communicative in a relationship, then just addressing those particular problems may solve most of the issues that they're dealing with. And the third type of psychotherapy is what we can call adaptational. And here are situations where the person really cannot change the situation they're in. They may be in a relationship that they can't get out of. They may need a certain type of employment that they can't change. Very common manifestation of this is people with physical disabilities or illnesses. They may have had an accident, contracted an illness, and now their physical capacity is somehow reduced. And there's no way that that's going to change. And here the goal is to teach them and help them become as adaptive as possible, as functional as possible, as creative as possible, as productive as possible, and as happy as possible, living in the world that is going to be their world for the foreseeable future. And although I divide these into three types, in the real world of therapy, very often these go together. So people may come in with a specific problem, the focus may broaden to something more general, person may come in with a general dissatisfaction with life and not be able to articulate what exactly is wrong, and through a little bit of additional focusing we identify certain areas that are targets for intervention. But in most cases, some combination of these approaches can help just about anyone who is sincerely interested in changing themselves for the better. Now, the contexts in which psychotherapy occurs has moved a lot from the traditional one doctor, one patient model. I mean, that's the traditional model of individual psychotherapy, and it's still probably the most common type of psychotherapy that's practiced today. But probably equally as common are two other types, which are couples therapy and family therapy. If you think about it, even in individual therapy, most of the things people talk about are their relationships. Relationships with parents, relationships with children, with family, extended family, workmates, and so on. And often if the problem, especially if the problem exists within the family, what better way to address it is if you can address it with the family. So family members may come in. There may be a parent-child problem. It may be a couple's problem. And what you do is by working with both people or all members of the family, not necessarily all in each session, but in different combinations, you get a better insight into what's going on with the family in terms of the dynamics and the communication within the family, and you're better able to help that family have a better relationship with one another. Group therapy is another modality, and here you have a number of individuals, this time unrelated, anywhere from 4 to 5 to up to 8 or 9 or 10 individuals, and here it's a combination of the therapist providing therapy to the individual patients, but just as important, the people in the group learning from each other. Because sometimes it's much easier to identify a problem in somebody else than it is in ourselves. And sometimes if we see how somebody else reacts to a problem, it makes that light bulb go off and makes us realize perhaps we have a similar way of responding and there's something that we can do as well. So here what you're doing is you're using the dynamics of a group. Again, because humans are social creatures, you're using that group to help each individual member work on their own problem while at the same time contributing to the recovery of everyone else.